So, going on the news right now, sort of, is the Healthcare Act. I don't really know the name of it right now. The Republican bill, it's called a lot of times. Maybe Trump Care, I guess what you could call it. I remember when Obamacare, or the Affordable Care Act, became a thing, and they said that they were going to insure something like 300 Americans. I'm not sure how many 300 million Americans. I'm not sure how many there are, but there's still like 22 million that aren't insured or something like that. There's a pretty good bit that still don't have insurance. I know I see them, quite a bit. In any case, I was working as a CNA when the Obamacare Affordable Care Act was signed, and it wasn't really supposed to change the hospitals. I was working at a hospital at the time, and I was also going to nursing school when it was signed. And before it got signed, I remember that every unit had LPNs. Every unit had LPNs. They weren't like the primary nurses, but they were there, and they were being hired, and they were being brought on, and LPNs were on the floor. And then the Affordable Care Act got signed, and little by little you started seeing the LPNs get gone. You started seeing, they started leaving specialty units, like cardiac. They left cardiac. They left pulmonary. They left, the pulmonary, cardiac, GI. They started little by little kind of cutting them back from the different units. We had, I can't even remember how many units we had at this hospital, but there were 9 floors. It was the largest hospital in North Carolina that I was working for. Or second largest hospital in North Carolina, I'm sorry. It was 9 floors, so little by little they started leaving each floor. Each floor was a unit, Oncology kicked them out, and so eventually they all ended up in med-surg and in ICU. ICU didn't utilize CNAs, they had LPNs, and basically your LPN was your CNA on ICU. Well, then all your LPNs became med-surg. Well, then maybe a year or so after the Affordable Care Act got signed, I guess it got implemented, because it got signed kind of late in the year, or about halfway through the year, and then it got implemented like the next tax year, I think. That next year, the LPNs were gone. They were just vanished. And not only that changed, but also they quit hiring BSN nurses, 2-year degree nurses, or community college nurses, whatever you want to call them. They quit hiring them, and all the BSN nurses that they had, not BSN, ADN nurses, the administrative degree nurses, community college nurses, they started getting rid of them. Not getting rid of them, but not hiring them. And the ones that they had had a community college degree or an associate's degree, they started making them sign contracts saying, we will get our BSN within 2 years or 5 years. I can't remember how many years they gave them, but they started only hiring BSNs, 4-year degree nurses, university nurses. And so they started kind of changing that a little bit. Well, I was going to community college, and so I was pretty much made aware that once I graduated, my job was not going to be at that hospital, because, I wouldn't be able to, there's nothing I could do, I could have probably contracted my way into staying there, But it was changing so much, and I wanted to stay. I really did, but it was changing so much that there's no way I could have. And then later on, about another, say, 6 months or so, I'm still at the hospital at this point in time. They've gotten rid of the LPNs. They've made all the ADNs sign contracts saying there'll be BSNs, and they started only hiring BSNs. Well, then, 6 months after they did that, they started calling CNAs and med techs and sec techs. Sec tech was a secretary who could also do a CNA job. They started calling them in, and they were like, listen, we're going to start cutting back. You're going to start having heavier loads, whereas you're going from, I don't remember the exact number, say it was 6 patients. Now you got to have 10 patients a night, or, like I said, I don't remember the exact number, but I know it increased. And this is about the time I graduated. And I found my job at a nursing home. Well, I actually went to home health first, but then I found my job at a nursing home. And then, it was like they just started getting rid of people and wanted more and more qualified people. And then they created like a nursing shortage. And I'm not sure if it's all to blame on the Affordable Care Act, but the Affordable Care Act definitely changed at least that one particular hospital. Within, it's like a 3-year time span, they changed that whole hospital. So it's going to be very interesting on how Trump Care or the Republican Act, or even if it gets approved, how it changes healthcare. Because I'm sure if it gets approved, if it gets signed or whatever it has to pass, I'm almost certain if it does, it's going to change nursing like the Affordable Care Act did. I saw it firsthand, and I can't necessarily blame it exactly all on the Affordable Care Act, but I know that it kind of changed things. So maybe this will change things as well. I don't know. It's just my little take on the healthcare systems going on right now. Hope it helps. Thank you much. Bye.